Hi guys, hello, I'm Jewel. Welcome to my channel. I started a series of videos called Travel Tips, a guide for kidney patients. The first video talked about, is it possible for kidney patients to travel? Which is yes. How should hemodialysis patients begin to plan a trip? How will I find a center to dialyze at? What if I need to travel in an emergency? Okay, guys, I want to tell you before we start that all this information comes from the National Kidney Foundation, and of course, you can find it there at any time. All you have to do is go to the website. Okay, guys, we're starting today at what information will my transient dialysis center need to safely provide dialysis for me? And remember, guys, I talked about in my first video, transient dialysis patient is a patient that is not dialyzing in their own center. You know, usually when you go away for vacation, they assign you a center. So that's what it is. Okay, what information will my transient dialysis center need to safely provide dialysis for me? Most dialysis centers require the following information to assess your health and plan for your treatments with them. The dates you need dialysis treatment, your name, address, etc., medical history and recent physical exams, recent lab results, recent EKGs, recent chest x-rays, your dialysis prescription, and 3 to 5 treatment records, dialysis access type, special needs of dialysis requirements, information about your general health, insurance information, where will you be staying in the area, and a list of medications you'll be taking during treatment and at home. This information will be sent to your destination center for review. It is possible for the doctor and transient center to know as much about you as possible to care for your needs while visiting their center. In addition to mailing your records to the center, you should hand carry a copy with you. The next question is, how can I be sure about the quality of care I will be getting away from my regular center? You may want to ask the following questions when making your arrangements for hemodialysis during your trip. Does the center reuse dialyzers? Does the center reuse bloodlines? What is the average treatment length of dialysis at the center? Can they provide the treatment time your doctor has prescribed? What are the hours and days of operation? Traveling patients often are placed on an evening shift, which could end as early as 7:30 p.m. or as late as 2 a.m. What type of dialyzers are used? Can you use the same type of dialyzer you use at your home center? What types of dialysis machine does the center have? Conventional high flux capability? Does the center routinely provide lidocaine? Are patients permitted to eat and drink while on dialysis? Is the ice machine available for patients? Is public transportation available to get to the center? How many patients are assigned to each nurse or patient care technician? And can you get all the medications you get at your home during your dialysis? Another question is very important to all of us that are traveling is, what if I get sick while I'm visiting another center? Don't overdo it. Be realistic when planning activities. Allow enough time to enjoy sightseeing, out, outside outings, activities without becoming overtired. Also, be sure to watch your diet and fluid intake. Guys, that's very important. Before you begin your trip, you will most likely find a doctor assigned to you by your transient dialysis center. Find out how to contact the doctor when you first arrive, and if you become ill, call the dialysis center or doctor as instructed. It is possible that a transient patient may require hospitalization. If this should happen to you, your transient doctor is prepared for this possibility and will care for you during your hospital stay. He or she will probably talk to your regular doctor or coordinate your care. You may feel more comfortable to know if this coordination has taken place. Being hospitalized while away from home can be a very stressful experience for any patient. It can certainly change your travel plans. Prepare ahead for this possibility. It can help make the experience less stressful. The following suggestions may be helpful, guys. Make sure your family knows your travel plans. Make sure you have important phone numbers with you, names of your regular doctors, dialysis center, etc. Have a copy of your medical records while you are traveling. Make sure anyone who is traveling with you knows where you keep your records and what your medications are. Make sure you bring enough of your medications you need to take to the last of the entire trip, and with extra to deal with possible emergencies such as lost luggage or spill, and also carry written prescriptions just in case. Okay guys, I'm going to stop right here on this video, and this is travel tips, a guide for traveling with kidney patients. And I want you to know, guys, that I use every single travel tip that they're giving you right now when I traveled on dialysis. So I promise you it is very, very useful. So if you like this video, please like, share, and subscribe. And for all of my dialysis patients that I'm talking to, I want you to know we are thinking about you. We are just hoping everything for you, which is good health, a good life, and to know that, there are people out there working so hard for you, and to know that this shall pass sooner or later. And just take care of yourselves, stay compliant, and until next time, guys, see you later. Bye.